Hi everyone, this is Erin Kling from the Running PTs, and I wanted to talk to you today about why recovery is important. Recovery is important because we have a tendency to overtrain and place more emphasis on the training aspect and not place enough emphasis on the recovery aspect. So what we're going to go over today are some concepts of training and how we can be better and smarter about our approach to it, along with what we should focus on when it comes to recovery. When you're looking at running volume, I want you to think of it as a graduated cylinder. And so if you remember back in chemistry class where you would fill up this graduated cylinder with a certain volume of liquid, and if you pour it in a little bit too much, it would overflow. So the idea is when it comes to running, it's the same thing. If you add in a little bit of volume at a time, that's all well and good. But if you fill it up too much, it overflows, and that's synonymous with your idea of getting injured. And so our bodies will be more prone to certain injuries just based on our anatomy, and that's completely okay. That's our structure. We can't change that, but we can respect and modify things for that. But there's a certain amount of volume in that graduated cylinder that is filled up due to our anatomy. Then let's say that we add a little bit more volume to our week by adding some more run volume and run mileage, and that's absolutely okay. But if you add that in on top of doing HIIT classes and spin classes and having all this extra work stress and not getting enough sleep, all of these things add up, one on top of the other, and basically give you a greater risk of injury. And so the idea is keep an eye on that volume, make sure you're not doing too much to a point that your body can withstand and adapt to it. Another concept to keep in mind is the idea of the acute chronic workload ratio. And this is the concept of what you do over the course of 1 week compared to what you do over the course of 4 weeks on average. And in this concept, the workload is volume, similar to that of what we talked about with the graduated cylinder, and its relation with intensity as well. And so intensity work can be speed work, it can be hills, it can be races, all of which are good to do, but it's something that you need to make sure you're not doing too much of too quickly. So if the ratio is a 1-to-1 ratio, that means that you have not made any change in your run volume and intensity over the past week by comparison to the average of what you've done over the past month. Now, if you have a significant change in what you do over the course of 1 week, that means that the top number is going to be greater than that of the bottom number. And so if that ratio turns into anything greater than 1.3, that increases your risk of injury by 2 to 4.5 times. So the idea to take away from this ratio is that increasing speed, increasing your volume is a wonderful thing to do to become a better, faster, and stronger runner. But you do have to make sure that you're very progressive about it and make sure that you're not having these really big spikes in activity, because that does increase your risk of injury. And the big thing to take away from all this is just that you need to listen to what your body is telling you and respect your anatomy. And so some things that you can do to help to prevent injury is to make sure you're getting adequate sleep, that you're having the proper amount of water, getting nutrition, getting the proper nutrition, that you're resting appropriately and enough, that you're strengthening muscles, and that you're working to improve both your flexibility and tissue mobility. And this is something that I want you to look at as to what you should focus on in particular based on the type of person and type of runner that you are. So think of everyone falling along some level of this flexibility bell-shaped curve. And so a lot of people will fall somewhere in the middle right through here where you're neither too tight or too flexible. But you do have outliers on either end where some are super tight and some are super flexible. And you know who you are for the most part. Those that are very tight are more prone to strains and joint restriction, where those who are more flexible are more prone to instability. And the takeaway from all this is just making sure that you have the proper balance between both mobility and stability. So those that are more flexible would benefit from working on more stability work and strength work, whereas those that are more tight would benefit from working on more mobility work and flexibility work. And those that are somewhere in the middle of the bell-shaped curve would benefit from working on a little bit of both. The idea is that those that are more flexible, it is not bad for you to stretch. And those that are more tight, it's not bad for you to do strength work. But it is helpful to know what you should focus on primarily. And so this just gives you an idea of what you should focus on based on the type of runner that you are. So the takeaway from all this is that I just want you to be able to look at your training, look at what you're doing on a day-to-day basis, making sure that you're putting emphasis on what you should, still training, but doing it in a very focused and specific way so that you're minimizing your risk of injury and recovering appropriately. So this is Erin Kling from the Running PTs. Thank you for your time.